Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Here's the headline: VA patient numbers jump after efforts to improve medical access. Now, look, in my mind, as I read that, I'm already thinking about the whole plan to cut the full-time employee headcount by attrition. And I'm just playing out all these scenarios in my head of, like I had said in previous videos, look, you've opened up the floodgates for healthcare through the PACT Act and expedited the access to healthcare, opened up that doorway to millions of veterans. And in the same breath of doing that, you're saying, let's cut back. We've already exceeded our hiring goals last year, and now let's go ahead and just slow roll hiring moving forward. And in fact, we'll probably hire less people than we actually lose, so we'll have a net negative. Great plan. So here it is, right? We're already now realizing it. VA patient numbers jump. No kidding. No kidding. April, May, what are we? February, March. March 5th was the opening of eligibility to millions of veterans who never qualified for VA healthcare before, and all of a sudden the numbers jump. Go figure. So let's jump into it here. I want to read through this article, see if we could pick out any nuggets along the way. Sometimes there's little read between the lines stuff that can help us understand a little more. So please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. Let's jump into it. Here we are on whatever day this is. It is the 28th, and I want to share this with you. So, Veterans Affairs medical sites saw a spike in patient visits and drop in wait times over the first half of the new fiscal year, thanks to the addition of more night and weekend appointments, Department of officials announced Tuesday. The expanded medical offerings, part of the department's Access Sprints initiative, which I did a video on this a while back too. This Sprints initiative offering kind of out of the ordinary availability, so weekends and nights. So this comes amid an aggressive push by VA leaders to bring more veterans into their system for health care following expanded eligibility for benefits as part of a comprehensive military toxic exposures legislation passed in 2022. Since March 5th, which that's the date that I figured out there for you as I was trying to remember what month it was, but since March 5th, all veterans who served in the Vietnam War, Gulf War, or any combat zone after September 11th, 2001 or 2001 are eligible to enroll directly in VA healthcare without first applying for disability benefits. Now, there was other doorways into the VA healthcare system, but applying for and receiving VA disability compensation is by far it has been by far the biggest doorway into the healthcare side of VA. But now that's not necessary for all of these vets. They can just go straight in. So, though the first 5 months of fiscal year 2024, which began October of 2023, because it's the fiscal year, new patient appointments are up 11% at VA medical centers, officials said. More than 80% of all sites have seen their total numbers of patients increase over that time compared to a year earlier. In addition, VA leaders said they saw 12% fewer new patients waiting for appointments beyond department guidelines. Officials said the Access Sprint initiative was the result of feedback from local VA facilities and regional networks looking for ways to improve timelines, efficiency, capacity, and employee experience. Now, leaders are hoping to continue those offerings. The VA Undersecretary for Health, Dr. Sharif Ellenhall, said that, I'm shrinking this up a little bit, said that some of the changes required extra staff to work or staff to work overtime. But most of the services were designed to be sustainable into the future months. We're asking every medical center and network to look very closely at what they can continue, especially since we discovered that we can see many more veterans with these improvements, he said. Department planners are looking to trim about 10,000 medical positions through attrition, which I also mentioned up front. And they're looking to do that this year, which is super exciting, facetiously, I say. So trim about 10,000 medical positions through attrition this year. But Alan Hall said he does not expect that to impact any patient care capacity. I don't see. I mean, 10,000 is a big number. Medical positions, okay, directly in your wheelhouse, and you don't expect that to impact any patient care capacity. Whatever, we'll see. Veterans interested in signing up for VA healthcare can contact their local medical center or visit the department's website. So, here's the thing. In order to apply for VA healthcare, it's the form 1010, okay? So 10-10. Now, when you think of the VA, it's a three-headed monster. You have VHA, which is the Healthcare Administration. You have the VBA, which is the Benefits Administration. And then you have the Cemetery, National Cemeteries Administration. So that's the three-headed monster. Obviously, cemeteries is kind of at the end of the line for all the right reasons. But healthcare and benefits are the two that we are typically plugged into. Now, they have expanded this March 5th and really kind of put the healthcare administration portion in front of the benefits administration. Now, this can be good for those millions of veterans. Maybe, just maybe, you don't have really great insurance otherwise, right? Or you don't have insurance for some reason, or you don't have great insurance, or whatever the case is. Your VA healthcare might be superior in your given geographic location. So that's good, because now you can get in and get seen. So that's a positive. Now, I will say that, let's just pretend. I get it. There are some VHA, the Veteran Health Administration, your hospitals or clinics that maybe are substandard, or you've been given horrible service at in the past. I get it. But there are some out there that are really good. And let's just pretend for this argument that they're really good. Okay. Here's my advice when it comes to your filing for disability compensation. Remember that in order to have a successful claim for disability compensation, monthly payout, right, anywhere between, shy of $200 to over $4,000 if you have a spouse and a child. So this is a big opportunity. But in order to get a successful claim, you need to have three things. One is time in service creates the window. And I always throw this disclaimer out there so everybody knows that I'm not completely crazy, that these three things are for conditions that are not considered presumptive. Presumptive conditions is a different beast and a much easier path. So, going back to this, your time in service gives you that window of opportunity, okay? Entry date, exit date. The second piece is a diagnosed condition. That diagnosed condition must be chronic in nature or have some sort of residual effects. In other words, it has to be an ongoing problem. The third piece is a nexus, a link between the condition and your time in service, that window of opportunity. What the VA is not looking for here is solely, show me that the military caused that condition. Sadly, we, in our minds, a lot of times, if we're not that aware, we think that that's what we have to prove. Prove that the military caused the condition. That's not what the VA is asking. Now, that is included, right? So obviously, if the military did cause that condition in some way, then sure, that works. But that's one piece of the pie. I like to explain it like this. The VA, for the nexus aspect, is looking for, show me that your condition manifested during your time in service or is a result of your service in some sort of way. Now, that opens it up more broadly, because manifesting during your time in service is really encompassing everything. So show me that your migraines started during your time in service. Show me that your GERD, gastroesophageal reflux disease, the bad heartburn, started during your service. Okay, so this is what you want to really focus on. In addition to the Humvee rolled over my leg and now my leg is all messed up. Obviously, that was caused by your military service. So this is the broad kind of sweeping what you need to do. There's different ways to prove those things, and that's a whole other video. But if you now have access to the VA healthcare system, you can go in and get diagnosed for all these different conditions. And I would say that if you're filing for either an increase, or you're filing for the first time, or you're filing for secondaries, you might be okay with the VA. However, if you're struggling with the Nexus aspect, your VA doctor is most likely not going to help you with a Nexus letter. They're not really into providing you that service, Nexus letter or disability questionnaire, filling those out. It's really, you might get lucky and find one, right? Maybe it's like an 80-20 chance, 20% yes, 80% no. The answer is always no if you don't ask, so try. But you might need to see a civilian provider to get those aspects taken care of for the Nexus portion of your claim. Now, utilize the VA to document your signs and symptoms and all that stuff. You must have your, we'll call it talking points down. Everything that you're being seen for is evidence for you or against you. Highly, highly suggest reviewing the schedule of ratings, having that information in your mind, in your hand, write it down, print it out, take it with you to your doctor appointment, and be able to share exactly what you have. Read all the criteria that is for each condition that you have, right? Read all the criteria for your condition or conditions that align with whatever percentage, right? So in order to have this percentage rating, I need this criteria, or this percentage, I need this criteria. Find the highest rating that you meet all the criteria for, and make sure you share that information with your doctor, with your CMP examiner, all of that good stuff. So anyway, if you are new to the VA healthcare system, welcome to it, and I'd love to hear your thoughts on your geographic location, on how the service is. Thanks so much for watching. I appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.